Well, hello, everybody. My name's Kevin Rudd. I'm President and CEO of the Asian Society. Welcome to our content series of conversations on Asian Americans building America. And these are folks from right across this great country who are making a positive impact on the United States and, frankly, have been in the front line of dealing with racism in America as well, particularly towards the Asian American community. Today, we're joined by Merlin Chowkwanyun. Merlin, have I pronounced your name correctly?
You have. Everyone thinks it's a lot more complicated than it is, but it's just three syllables and you say them fast and phonetically. So you got it.
That's good. And you're assistant professor of sociomedical sciences at Columbia here in New York. So Chowkwanyun, just tell me as a name, is that the Chow, is that a Zhou? In terms of which character is it?
Yeah, that's right. My grandparents are both ethnic Chinese, and they moved to Thailand in the 1950s. And there were these citizenship laws where if you wanted to become a citizen, you had to adopt a name that sounded Thai. And so one common trick that a lot of Chinese migrants did was just mash a bunch of surnames together until they got that's what this is. Yeah.
That's what I love about the Chinese, is you're always inventive about how you navigate your way through these things. Yeah. So tell me, Merlin, you're in New York, you're at Columbia, and you're an associate professor. What's your reaction to what you see in the headlines and in your day-to-day experience on this phenomenon of anti-Asian hate across the United States? Give me your sense of it.
Yeah, I think there's two reactions. One is a gut level as a human being, and just as an Asian American myself. And one is my other hat, which is as a scholar who takes gut reactions, but then tries to critically distance himself from those gut reactions and tries to situate it in some kind of longer context of some sort. So I guess I'll talk about both of those, but I'll start with the gut reaction. I think the gut reaction is very similar to that of many Asian Americans, which is a mix of fear, a little bit of anger over the sort of political currents that I think have given rise to some of this anti-Asian animus, not just in the past 4 years, but I think actually it goes back a little bit longer than that. I think you could root it into like the late 1990s and even farther than that. I grew up in Los Angeles, where I believe is actually the highest concentration of Asians in the United States. And most of the Asians in Los Angeles arrived after 1965, when a revision to the Immigration Act opened up huge waves of immigration from East Asia. And a lot of the initial reaction to that wave was not always positive. So I grew up in an area of Los Angeles that was pretty much 100% white. And then over a period of 20 years became majority Asian, but not always a smooth process. So I was reminded about a lot of the kinds of remarks that I would hear in schools about the increasing number of Asians in the school and how it seemed to make certain people uncomfortable and so forth, and anti-immigrant sentiment. And so I think this current moment brought a lot of that back to me, just on a.
Did you experience a lot of that in school yourself?
Yeah, when I was growing up around kindergarten to third grade or so, I was usually one of only a few Asians in the class, and then I noticed that as I grew older, the demographics of the school also reflected the demographics of the area. So I could kind of see that the response changed over time. I don't know if I want to say if it was a linear thing, like better or worse, cleanly in one direction or the other. I think, like much of the country, the United States is trying to still figure out how Asians fit into our category of our conception of race and where people fit. For the longest time, it was essentially a binary conception, right? This is a black and white nation. And then around the 1960s or so, people start to realize, oh, wait, we have Latinos or Latinx people in this country now. So we kind of have a tripartite scheme. And then I think slowly people are still trying to figure out what to do with the changing demography, and they haven't quite figured that out. And so I certainly saw that firsthand growing up. And I think you see a little bit of that now. Yeah.
Tell me, in your own academic field and your engagement with research and the rest of it, have you experienced racism in a professional environment as well?
Yeah. You mean in just kind of interactions with other people in the profession and so forth?
Yeah.
Certainly. There's definitely and I want to say at the outset that the Asian population itself is very heterogeneous. And so I'm speaking mostly as an Asian male. A lot of my Asian colleagues who are women or, gender non-conforming probably have different experiences. So I'm speaking as just an Asian male. I just want to put that out there. But certainly there is a stereotype that Asians are demure and quiet, right? This is not exclusive to the US. It's there. And I noticed early on in my graduate school.
The reason I'm laughing is I've got two Chinese American grandkids. They are neither retiring or demure.
I got a couple of cousins who live in Thailand around the same age bracket, I'm assuming, and same thing there, right?
They're a lot of fun. I really enjoy them. But, anyway, sorry, interrupted.
No.
You're onto stereotype. Yeah.
Yeah. So I definitely noticed early when I was a graduate student, getting my PhD, the first time I was giving presentations at conferences and things like that, just kind of presenting on my research. I noticed that the questions, the tone of the questions and the content of the questions could sometimes be incredibly aggressive in ways that I wouldn't see when a white graduate student was speaking, particularly a white male student. And so I noticed that, and it was very jarring. And I'm a pretty quiet guy just in general, and fairly reserved. So I didn't exactly know how to handle that, and it was pretty upsetting. I think it was upsetting not only just the experience itself, but there's a phenomenon that this anthropologist named Jonathan Jackson writes about in a book he called Racial Paranoia. So what does this term mean, racial paranoia? It's the feeling that an ethnic minority gets that the reason for some kind of poor treatment is due to that ethnic minority status, but they can't quite prove it, the way you can prove, a math problem or something like that. And so that's the racial paranoia. And so I felt a lot of that, and I was like, is this just because the person doesn't like me, or is it because of the way I look? And that was incredibly frustrating. My solution to that was always to adopt a speaking style that is, in fact, actually nothing like I am as an actual person. So this kind of conversation that we're having right now and the kind of volume I'm talking to, that's not what I'm like when I'm lecturing in class or giving a presentation. I said, if they're going to think about you as this way, you're going to have to give them that way. And so it's a very kind of loud, almost theatrical, kind of approach. And when the questions came, I said, if you get a question like that, you don't move, you look them right in the eye, you don't get phased the way you used to when you were a young grad student. So it's kind of this preemptively defensive and kind of come out at 100 miles per hour way. And I enjoy the speaking style, but I do, at the same time, it's also a little frustrating that one has to do that. And, I'm sure women in academia can tell similar stories about gendered stereotypes and gender dynamics in questions and answers and things, the strategies that they've had to adopt to address that too. So I would say, that's something that I definitely have experienced and have tried to address in some ways.
You've written a piece entitled "Race is Not Biology," and it's basically about unthinking racial essentialism. and how that finds its way into scientific research. Give us, the 3-minute overview of, I'm sure, what's a complex body of science.
For sure. That was a piece a few years ago, I think, in The Atlantic. And yes, it was called Race is Not Biology. It has to do with a resurgence of claims, sometimes explicit claims and sometimes implicit claims, that I think have resurfaced in the past 20 years or so, that race is a biological thing that's in your blood, that, Merlin has an Asian gene, Shaquille O'Neal has a black gene, except.
And I'm from Australia, and we got genes from everywhere. Let me tell you.
And then it's basically the idea that race is this biological fact that's in the blood. And in that article there, I said there are a couple problems with this. One is that we have evidence from just a few decades now of population genetics that shows that actually when you take, the genome of someone like me, an Asian, you might actually find I might actually have more commonalities with you, a person who is not Asian, than another Asian. So the categories themselves are not, in fact, biological. They are, in fact, social. And the problem with people who make claims that race is a biological thing, I think one is that you're kind of erasing the reasons why people erected these social categories. Sometimes these social categories can be empowering, but often they're a way of putting a label on a certain population and then saying that is a natural biological thing, and therefore that person should be treated differently as a result. And we need to know that story and how that happened. And if you simply say, well, race is just this kind of natural biological thing, you erase that kind of social and historical story. I think the second reason why it's alarming has to do with the world I'm in. I'm in the world of public health and medicine and the health sciences. There are a lot of studies now that show many of our diagnostic tools, although there's a lot of reform now on this front, many of our diagnostic tools actually assume that there is biological racial difference, even though you have population geneticists saying this is not true. And they'll do things like apply an algorithm where if you are Black, you might have a higher or lower bar to be diagnosed with something versus, say,
really?
Person. Yeah. Or
what do you mean, like diabetes or what? I mean, what do they do?
The race correction is used actually in a number of specialties. I think the most research, on this has been done on respiratory diseases. But my colleague at Brown University, Lundy Brown, has written quite a bit on spirometry and how this little device that measures your lung capacity, your lung function, often has these kinds of assumptions built in. And so that's very dangerous, I think. Just, when I go to the
so we got race-based algorithms in medical diagnostic testing.
That's right.
That's stunning. I didn't know that.
It is. When I first learned about it, I said, this can't be, because, when you go to the physician, you expect that they're going to do a kind of full examination of Merlin Chowkwanyun, the individual, and then kind of give the assessment based on the things that they observe, not take these kind of little proxy shortcuts and then automatically assume certain things about me. So that's one reason it's alarming. And then, I think another reason also is, as you know, and as I think has come to the surface in the past year or so, especially, there are just glaring racial inequalities in health. And often these are socially rooted, right? It's because people live next to, a toxic waste site or a diesel bus route, or, they don't have enough money to buy nutritious food. So they develop, diabetes or something like that. These are all kind of social reasons why these racial disparities exist. But if you have this race equals biology idea, often what happens is people won't explore those social reasons again. They'll just say, oh yeah, the reason there's a Black-white disparity in respiratory diseases because Black people have weaker lung capacity because of their genetics. And so that's the danger. And that's why I wrote that piece.
Whereas poverty produces bad health, and wealth often, but not always, produces pretty good health.
That's right. That's right. That's the thing we want people to think about, and they don't think about it when they graft this biological race story onto it.
Tell me, what advice would you give to a young Asian American? And I'm categorizing you as young, by the way, so you're fine. Encountering racism on the streets or in the office, how have you navigated that? You had an interesting comment before about changing your presentational style. But if you're running into someone who's a young student, or frankly someone who's just opened their first startup, or someone who's decided to, set up a new restaurant on 100th and Lex or whatever, so other side of the island from where you are at Columbia. But what's your advice to how you deal with this psychologically, personally?
Yeah, I kind of have a bucket of pieces of advice, I would say. The first one, I think, is actually one that I've actually had some debates with other Asian Americans. So it's a very kind of pragmatic strategy. And the strategy is basically this: pick your battles. So there are times when, if you're on a bus and somebody calls you a racial epithet, for a while, I would just kind of absorb that and be upset about it. And then there was a period in my life where I said, every time somebody does that, I got to stand up for myself, really for just kind of psychological self-worth reasons. And you find if you do that, it can often just escalate and get worse and make an already bad situation even worse for you. So sometimes you have to do calculations there and say, look, this is an extremely unpleasant encounter. It's not fair you're having it. But if you do what you think is the right thing to do in the moment, is it actually going to make life even worse for you? So I always say, pick your battles. The second is to remember a phrase I study the history of social movements. That's one of my areas. And I think if there's one big lesson you take from that is, if you see an injustice, don't go it alone. Don't combat it alone. You can't do it alone. You can have the most, airtight critique and strategy of how to go about fixing a wrong, but it's rare that one person alone is able to change things. You got to do it collectively. So if it's something like a workplace, to take some of your examples, I think you want to find other people who have experienced similar things and kind of come together to see whether or not you can find some strength in numbers. So that's one thing. Is always remember, you don't have to shoulder the burden by yourself alone. And then the third thing is, I think, try to find some cross-racial solidarities and pay things forward also. So two of my most important mentors, both at the undergrad level and at the graduate level, who really kind of taught me about thinking about race historically and race in public health and the things you and I have been discussing, were African-American scholars. My colleague now, Samuel Roberts at Columbia, was a terrific historian and a political theorist named Adolph Reed at the University of Pennsylvania. And we would often have talks about, these hierarchies in the academic field and how they navigated it and so forth. And so I not only try to find other people who are experiencing that, and to my earlier point, try to put our heads together, but I also try to pay that forward also when it comes to minority students, not just Asian Americans, but anybody who might face discriminatory behavior. Period. I try to kind of pay what they gave me forward. And then the last thing about being an Asian American specifically, I always have said that in the scholarly world, but you could apply this, I think, to the business world or entertainment. I think you want to ultimately not feel pressure to do something just because you're Asian. So I think one of the great things that could happen for Asian Americans in the next 20 years is not only do we get, more films and artistic productions and fields of inquiry that are about Asian Americans, but also by the same token, Asian Americans have the freedom to also pursue things that are not about Asian Americans or Asians. My primary field of study is the history of public health and the history of race, but I am not per se an Asian American history specialist. I've certainly started exploring it a lot more in recent years, but I think that kind of latitude and flexibility for Asian Americans to aspire to what they want to be, whether it's focusing on Asian American topics or doing something completely different, or focusing on Asian American businesses or doing something completely different. That's something I hope to see.
Well, Merlin, it's been fascinating talking to you. I commend you on your field. I think it's fascinating. I really like the idea that to your closest academic collaborators and academic mentors are African Americans, and looking at the wider phenomenon of race in America. And your research and your writings on race not being biology is really important as part of the understanding of and response to this kind of ugly phenomenon we've seen in recent times in particular. China virus, Wuhan virus, go home, all that sort of stuff. So thank you for being part of our modest attempt at the Asian Society to roll back the tide, and for talking to white guys like me. I think I really appreciate that. So Merlin Chowkwanyun, thank you very much for being with us today and for your steadfast dedication to the challenge of social activism, racial equality, and frankly, building a better America. So we appreciate what you're doing. It's inspiring. I'm Kevin Rudd. I'm from the Asian Society. Thank you for joining us.
Thank you.